Welcome to the Health Zone. My name is Dr. Toju Chikiobi, but everybody calls me Dr. Toju. We have a wonderful show lined up for you today. We will be talking about mother, newborn, and child health. And you know what? That's a very, very important topic because 162,000 women die every year in sub-Saharan Africa for problems related to pregnancy and childbirth. And we lose 1 million babies in their first 28 days of life. It's a very, very important topic. And we have two amazing guests with us today who will help us figure out the things you and I can do to prevent the risk of death in pregnancy and childbirth, and to make sure that our little babies, our little wonderful ones, survive through and beyond their 5th year of life. Please don't go away. Welcome to the Health Zone. We have a fabulous episode today. We're going to be talking about mother, newborn, and child health. I'm going to keep it simple. And we have terrific guests with us here today. We have Dr. Orade Dorothy, who is coming back to us after a fashion. She did World Malaria Day event with us, and it was great working with her. But Dr. Orade is with us here today, and we're really pleased to have her. She's a board-certified pediatrician and a public health physician. She's the country director for an international nonprofit agency called Africare. They're very involved in communities that are supportive of the development of women, children, and babies. They help create livelihoods for members of the community and help with just improving their health literacy and just the basic health of all members of the community. So it's really wonderful having her here on the show with us today. Dr. Orade, welcome to the Health Zone.
Thank you for having me. It's nice to be here.
It's so good to have you here. I'm looking forward to our discussion. Our second guest is Dr. Chito Nwana, and she is a returnee, old hand. She's been on the show a few times for us, and so we're really pleased to see her back with us here today. Dr. Chito Nwana is a board-certified obstetrician gynecologist and the medical director of Tabitha Medical Center in Abuja. She is also the chairperson for the Guild of Medical Directors, the Abuja chapter. She really has a passion for community outreach and anything that has to do with women's health. She's very, very passionate about. And so we're really honored to have her here with us in the studio again. Dr. Chito, welcome to the Health Zone.
Thank you for having me.
It's good to have you back.
Thank you.
So, as is our usual custom here on the Health Zone, we're going to go out to find out what the man and woman on the street know about mother, newborn, and child care. And I know they have so much to tell us about because we know we have major problems in those areas in this country. So don't go away, stay with us. Let's watch the video together.
Today we'll be talking to the man in the street. Why do you think that women have complications during childbirth?
I think lack of care, I guess, like appropriate health care, I guess. Negligence, medication, drug abuse, alcohol.
Okay, have you or anybody that you know experienced complications during childbirth?
Yes. Family members and, friends.
Yeah. And how was it for them? What was the experience like for them?
She waited till it was really, really complicated for her to get medical attention, and by then it was too late. We've had situations where the baby wasn't in the right position. Baby was breached, or the baby didn't come out at the particular time the baby was supposed to come out, like the EOD.
Do you think there's a difference between formula and breast milk?
Of course there is.
Okay, what's the difference?
I don't know, but I think there's some nutrient there. I think there are certain nutrients you can find only the mother can only produce that you can't synthesize.
So I'm going to start with you, Dr. Chito.
Yeah.
How can we ensure that women survive and remain healthy during pregnancy and the process of childbirth?
Like you said before, the maternal mortality rate globally has gone down, but still we have pitiful numbers in sub-Saharan Africa. And the major issue then was access to healthcare. And as access has improved for some places, it's still limited for many. And that gives rise to deliveries by workers or health workers that are not skilled to do that job. One of the things that really concern me in these areas where they lack access to health facilities is that you have traditional birth attendants and skilled and community health workers that cannot recognize when there's trouble, when there's complications that need them, that at that time they would have referred the patient to a more tertiary center, and that's why most women die. But just to go back to your question about what we could do, number one, health education. So when we go out for these outreach, it's not about just providing the care that we think they don't have, but it's about educating not only the health worker or the TB or traditional birth attendant, but also educating the women themselves
Yes.
on what to do, what they will feel if they're having like high blood pressures, or what bleeding means in pregnancy, and also about simple things like nutrition. These are difficult times, so we're expecting even more issues where it concerns nutrition. And we know that something like malnutrition is very, very significant where it comes to a healthy pregnancy. Because if you're malnourished, you are high risk for preterm delivery, and you can imagine that happening in that kind of area. You definitely know that the baby may not make it, and you're also at risk for low birth weight and also birth defects, which again, if defects are noted in that area, babies sometimes may not survive it. Antenatal classes, we know in the urban hospitals or the more skilled facilities has really shown to reduce complications in pregnancy. So we know that this is something that if we promote in the rural areas, it will definitely affect or reduce how much maternal mortality we see in those areas. Another thing is antenatal care. Now, again, it comes down again to assessing the facilities to receive antenatal care, or training those in the community to know how to deliver antenatal care. Yes. And, like the World Health has said that, that we should have at least 4, or these women should please have at least 4 visits to the doctor in their early pregnancy, in the second trimester, and 2 in the third trimester. Now, I'm going to just put my line here and says that's more for the rural areas where access is limited.
Yes.
This is not a message to those who are in places where they can access healthcare and say, you know what, they said 4, so I'm going to go for 4. Yeah. There are good reasons why we have the number we have of visits that you should attend. But in those places where there's limited access, if they can make it to the facility 4 times in their 40 weeks or 10 months pregnancy, then at least we know we'll be able to catch the things we need to catch before they become a problem in the pregnancy. Yeah. Yeah. So these are the ways I think we need to address it, and again, education is key.
Okay. What about during the process of childbirth itself?
One of the key things there is, you don't, no matter how, most of the times we go to community and we talk about access to health facilities, we realize that, they're not going to leave these traditional birth attendants and the community health workers are there for a purpose to try and, offset some of these issues. I think the most important thing is helping them to identify when there's a complication. When there's a
problem.
We know what the common problems are, in terms of hemorrhage, bleeding, infection. So it's now teaching them how to identify when it's a problem, how much bleeding is okay, and how much bleeding warrants secondary attention. And it's not only identifying those complications, but also being able to say it's time for them to move. Yes. Because, see, timing is very important. If you see bleeding and you think, oh, it's not that bad, by the time it gets really heavy, between the rural area to the nearest hospital, you can see that they're not going to make it. They might die just on the way getting there. Yes. The same thing with blood pressure issues. It's just identifying when this is a problem. This patient needs to now be seen by someone more skilled than they are in this area.
Okay, excellent. And why is all of this important? when we talk about maternal deaths? Why is it important to us as a nation?
It's important because mothers are, I mean, there's no nation without mothers, right? And I think that, when mothers die, the family is seriously affected. These kids are now without mothers, and sometimes what we see, even in the urban areas, when mothers die, the fathers abandon the children. They feel they cannot take care of the kids, they can't raise the children, and the kids end up becoming orphans and end up in the orphanage. So it really does affect how we are as a nation, and that's why I think maternal health has become such an issue all over the world.
Yes.
Because we know that when women die, the family dies.
Yes.
And we
Yes.
can't afford for that to happen and believe that we'll have a great nation.
How can we ensure that newborns survive and remain healthy during that process of childbirth and in the immediate neonatal period?
So thank you for the question. It's really important for us to recognize that the care of the newborn actually starts during the pregnancy. And I'll make the argument for even before the pregnancy. We can
Yes.
talk about that later. During the process of pregnancy, there are certain things that will clue you into the fact that the newborn could be at risk. Women who have high blood pressure, who have diabetes, they need to be seen by a skilled attendant, somebody who can care and provide for care for the baby when the baby is born as well, because some of those babies are actually compromised when they come out. Women with short stature, they need to be
That's
taken
short
care of.
women.
Yes, short women. They need to be taken care of by a skilled attendant, both during the prenatal period, but also at the time of delivery, because there may be issues with the baby actually coming out. So you need to be in the presence of somebody who knows what to do, as Dr. Chito has alluded to. So in the process of pregnancy, it's very critical also that the important things that the baby will need in the first month of life are laid down in the mother. So iron, in order to make sure that the baby is not born with a low blood count to start with. Calcium, in order to make sure that the baby is healthy at birth and can meet all the milestones, all the normal developmental. And then we go to the actual delivery. At the time of delivery, we know that more than half of our women are still not delivering in the presence of a skilled birth attendant or in a hospital. So at the time of delivery, there are 6 cleans we talk about, where at least people should have access to. There should be clean hands, running water, make sure that they're clean hands or gloved hands, that the surface where the mother is going to have the baby is also clean, perhaps sterile. We ensure that whatever it is that we use to cut the baby's cord is clean,
Yes.
is sterile. So we don't allow old blades, used blades, those types of things. Everything has to be clean and prepared for the delivery. In addition to that, the tying off of the cord, right, is to be done with the sterile instrument. Sometimes we have cord clamps. Sometimes we have a cord tie.
Yes.
It's important to equip women who are taking deliveries in communities with at least these types of
Simple
things.
tools.
Very simple things. And then the presence of chlorhexidine, which is an antiseptic, is also used at the time, right from within 24 hours of delivery, is used to clean the cord at least once a day, making sure that the cord remains clean. And then we also have to remember when the baby is born, the baby comes out a bit wet, cold. Baby has to be wrapped up in clean towels, clean cloths, and cleaning up of the mother, the birthing area, as well as whatever the mother is wrapped up in. Clean, 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 clean,
Yes.
clean, clean.
Yes.
Very critical. So those things are important, at least to maintain asepsis, because the things that cause death, infection, we say infection, but we know there's infection, there's bleeding, prematurity.
Yes.
A lot of our babies are born before the time that they're supposed to come. In many parts of the world now, and in Nigeria, this was actually first piloted by a Nigerian pediatrician. Kangaroo mother care.
Yes, yes.
And kangaroo mother care is actually very useful because it keeps the baby warm and protected. And it's skin-to-skin contact between mother and baby, especially when babies are very small, preterm. It's also important for early initiation of breastfeeding. So when the baby is first born, we say place the baby skin to skin with the mother. And in doing so, ensure that the mother begins to get all of those sort of good feelings. You know, when the baby
Yes.
first comes out, all the, I don't want to say trauma, but all the excitement and the drama of baby coming out.
Yes.
The next thing is skin to skin contact with the baby, and as much as possible within 1 hour of birth, initiating breastfeeding. Starting breastfeeding within 1 hour of birth is actually found to reduce by up to 20% deaths in the newborn period.
Yes.
And that's because the earliest milk that comes out contains very highly effective antibodies, which you want, if you want to call them the antibiotics of the
Some
newborn
natural
period.
ones, yes.
Okay, these are important as well. And then breastfeeding exclusively for 6 months.
Yes.
That's critical. That actually has the highest impact on infant survival.
Terrific. I'm so glad you mentioned all of those things, because I think it's something that we're going to have to keep emphasizing and re-emphasizing, because we can't hear it too much. Because you're still finding today people who are breastfeeding who are getting pushback from mother-in-laws and grandmothers.
Absolutely.
You know, so this is something, pushback about breastfeeding, or trying to breastfeed in a public place covered. You're not seeing anything but getting pushback from people around as to why you're doing that here. You know, and we'll talk about breastfeeding because, you know, I know both of us, that's a passion of ours. So we'll talk about that a little bit more. But what were you going to say?
I wanted to add one more thing, and that's really critical. We talked at the beginning about clean, clean, clean.
Yeah.
It doesn't end at the delivery. It is a practice that must continue
Yes.
throughout the time that a child is being cared for.
Yes.
Hands must be washed all the time. You can never wash your hands too many times when you're caring for a newborn. And this is a critical thing for all mothers and all people who care for newborns. Your hands must be washed. And there we talk about specific times when you must wash your hands. Every time you're going to handle the baby, you must wash your hands. Every time you've handled the baby's diaper, you must make sure that your hands are washed. Before you prepare the baby's food, at the time when the baby starts to get other than breast milk, you must wash your hands. Every time you use the bathroom, you must wash your hands. And every time you remember, you should wash your hands.
Absolutely. Thank you. Hand washing, hand washing, hand washing, hand washing. But I want to go back to breastfeeding a little bit again. Why is breast milk better?
You know,
Because I think sometimes I almost feel like we have to make a case for breast milk. Why is it better?
breast milk is it's a liquid that contains foods. You know, the girl in the video said it's not made anywhere else. We actually haven't been able to get the formulation of breast milk. It contains hormones. It contains long-chain fatty acids. These are big, big words, but they all have a
The
role
good
to
fats.
play. Yes. Hormones are very important for both the mother and the baby in the early breastfeeding period. And it's important that baby actually gets access to all of these because they help to regulate the baby's sleeping and waking cycle as well. The long-chain fatty acids are the good fats that help to build the brain. We can't get that anywhere else, and we've tried. It's not available in any formula, but it's available in breast milk, and it's available every time the baby goes to breast. There's long-chain fatty acids in there. There's a lot of water in breast milk, so it quenches thirst. Breast milk also contains the very first milk that comes out, colostrum, actually contains antibodies that protect the baby actually through the end of the 6th month of life. And so that's really important because that's your baby's first immunization.
Yes.
Okay? We haven't been able to devise that except with all the shots that we're giving. And even those, we still bow down to breast milk because breast milk still has, because everything that the mother has been immunized against, the baby is immunized against by virtue of having received mother's breast milk. In addition to that, you know, breastfeeding is a time of bonding. It's a time of closeness. It's a time when you can sort of calm the baby down, and it's a good time to interact with mothers. Mothers will tell you, you know, I want to go away and nurse. And they're saying it because they also need that time.
Yes.
It's a great time, and it's something that we should encourage. We always say, you know, as much as possible, if you want your female employees to come back to work on time, put up a creche, make sure there's somewhere where they can go to and nurse their babies. You have a happier employee. You definitely have a better outcome in your organization. So
Absolutely.
breast is best.
Thank you. Breast is best. I like that. So how can we improve health outcomes for our under fives, for our young children?
The things that put under fives at risk for illness and death are, in Nigeria, malaria, pneumonia, diarrhea. These all the underlying cause of their propensity to get very bad really is malnutrition, like we talked about earlier. So in these children, I think what's most important is that mothers must understand that a child who is ill should be seen very early. If a child has a fever, child should be seen within 24 hours. That's the Nigerian national policy. That's what we want to ensure that mothers understand. You can't treat a fever at home in a child who's under 5 years old. So take a child to a trusted healthcare provider. So if they have malaria, they'll make a diagnosis and then treat. If it's pneumonia, they'll pick it up. If it's diarrhea, the mother may already know. It's useful when our mothers already know how to prepare the oral rehydration treatment at home, but it's just as important for them to go to the health facility, for them to get the sachets, get zinc as well, because they also add zinc to the treatment of children with diarrhea, but also to get the education and for the child to be appropriately rehydrated should there be a need for them to be rehydrated intravenously. So that's one thing. So recognizing illness early and ensuring that they get to a trusted healthcare provider is important.
So we have been talking with Dr. Chito Nwana and Dr. Orode Dorothy about maternal, newborn, and child health, and they taught us so much. Don't go away. I will come back and recap some of the important things that they want you to keep and never ever forget. So don't go away. Stay with us. We learned so many important things from Dr. Orode and Dr. Chito about mother, newborn, and child health. And so I'm just going to recap some of the important things that they said. Antenatal care is the care of a pregnant woman and is vital for the well-being of both the mother and the child. Every pregnant woman should receive antenatal care. A minimum of 4 visits to a doctor or midwife is recommended to ensure the well-being of mother and child. It is extremely important that all women give birth attended by a skilled health professional because timely management and treatment can make the difference between life and death. Pregnant women should seek immediate medical attention at the first warning sign of potential complications. Please do not delay. Severe infection is a significant cause of death in women and newborns during childbirth and in the immediate weeks after childbirth. Clean practices and good hygiene are very, very important during childbirth and when caring for newborns. Wash your hands, wash your hands, wash your hands. Exclusive breastfeeding during the first 6 months of life is vital. Of all the things that have been tried to improve infant deaths worldwide, this has had the highest impact on survival. Health outcomes for women and children can improve through good health practices like hand washing, vaccinations, exclusive breastfeeding, better and family planning. This has been Dr. Toju reminding you, stay healthy.